Hey, thank you for tuning in to the Healthy Returns podcast. Better health, better business, unlocking the potential of body composition. And today we are going to be talking to Dr. Jason Chiriano of Viva Life Healing Centers. And he was a vascular surgeon. And so he came from conventional medicine and he now works in functional medicine. And we are going to be talking about visceral body fat and the hidden health risks. This is really important to Evolt, and it's why when we created the technology, we really wanted to make sure that we didn't just give you total body fat percentage, which is what 90% of people think that they need, but we really wanted to separate out subcutaneous from visceral body fat, because visceral body fat is really far more dangerous than subcutaneous. Subcutaneous body fat is the fat underneath your skin that kind of keeps you warm. Visceral body fat is the fat that invades your organs and your muscles and your abdominal cavity and really leads to health problems like type 2 diabetes, heart disease, non-alcoholic fatty liver disease, dementia, cancer, things like that. So this is why it was really important to us to have this conversation with Dr. Jason Chiriano. So stay tuned. I want to welcome you back to the Healthy Returns podcast. And we are talking to Dr. Chiriano from Viva Life Healing Centers in California. And today we are talking about visceral body fat and the hidden risks. And one of the reasons why Evolt really feels so strongly about visceral body fat and why we have so many measurements of visceral body fat is we know that it is indicators of multiple diseases. And so that's why this conversation is so important. So I want to welcome Dr. Chiriano to the show. Thank you so much for joining us.
Thanks for having me. I love this topic.
Yeah, so tell us a little bit about your background, because I know it's pretty cool, and then what you're currently doing, and then we'll get into a conversation.
Yeah, so I'm a vascular surgeon. I did that full time for 15 years. I'm double board certified in general and vascular surgery, and then got into the health and wellness space back in 2019, opened my center after having my own health problems. So I had a bunch of visceral fat, and I was 240 pounds and pre-diabetic and on metformin and 7 other medications, and this was pre-GLP, obviously, so there was none of that going on. So I kind of wasn't getting good help from my doctor, so I kind of took things into my own hands and fixed myself, and now I'm transforming other people's lives doing that. So.
Yeah, and I mean, I think that that's the key, is that we learn from personal experience. I've struggled with my weight my whole life, even though I'm very, very small. Both my parents were obese, and I literally lived my entire life hungry. Because I was so afraid to end up like my parents. And then as we go on our own journeys, we realize how many people we can help. And you help so many people on a daily basis with things like this.
Yeah, I mean, I think it's, I think insulin resistance and the metabolic syndrome is at an all-time high. The obesity epidemic, the processed food, the SAD diet, the standard American diet, everybody's on their road to diabetes. So about half the population, statistically speaking, is on the road to diabetes. So, and
it's so interesting that you say that, because I get so many clients that come in and they show me their lab results, and they'll say, my doctor says I have perfect labs, and their A1C is literally almost out of range. Like they're 1 point away. And I go, did your doctor even mention this to you? Oh no, they said everything was perfect. And I was like, okay, well, we need to make some lifestyle changes. And that's really the reason we have these kind of conversations, is because everything starts with lifestyle. So why is visceral fat this hidden health risk that people hear about it, but they really just don't know how it's really affecting them? They really don't even know how they've put it on.
Yeah, so it's interesting because there's obviously two different types of fat in our body, right? So we have our subcutaneous fat and we have our visceral fat. Subcutaneous fat is thought to be pretty innocuous, so not really associated with health risks too much. But that visceral...
And that's the fat underneath our skin, basically, correct?
Outside fat, right? But what happens is we only have so many fat cells in our body. So as those fat cells start filling up with fat, at some point they're totally full. So that fat that we're ingesting and everything else, and when we get the insulin resistance, then have to be deposited somewhere. So it starts getting deposited in the liver, it starts getting deposited in the muscle, it starts getting deposited in the pancreas, in the mesentery of the gut. And as a surgeon, I've operated on obese people. It can be profound how much visceral fat is actually in a person's body. But the problem with the visceral fat is that it secretes a lot of inflammatory cytokines like TNF alpha, IL-1, and this is the fat that's right near our vital organs. And so that's why it becomes a big problem with long-term health problems. So diabetes, Alzheimer's, cardiac risk, cancer.
Well, I was just going to say that. So let's go through them one by one. We all know about type 2 diabetes, right? That's like that we talk about this all the time. But now we're starting to talk about this type 3 diabetes, this dementia that's caused by this. So that's really one of the things that's kind of new that we're talking about.
Yeah, I mean, I think it all goes back to the metabolic inflammation and that chronic inflammatory state that we get into. So, we can talk about gut health about that too. So, if we're inflamed in the gut or anywhere else, our brain tends to get inflamed as well. And that over time leads to neurodegeneration and unfortunately dementia.
Yeah, so that's our first problem is going to be the dementia. And then heart disease. Let's talk about heart disease because I know that that's another big, people know about type 2 diabetes, but they don't quite understand how it's affecting their heart disease.
Mm-hmm. Yeah. So again, when you have the visceral fat, you have the inflammatory cytokines, and you're dealing with increased cholesterol, not cholesterol itself, but maybe increased apolipoprotein B and some LPA, which are the carriers that surround the LDL and the HDL. When those start entering the endothelial wall in the setting of inflammation and insulin resistance, you're not getting that metabolism, you're not getting the protective effects of insulin sensitivity. Then those plaques start building up over time, and that can start as early as our teenage years, even before then. And so by the time that we recognize it, we're already way behind the 8 ball. It's a silent killer. But you can do autopsies on young people's blood vessels and see fatty streaks, which is the beginning of atherosclerosis. And we know that more and more of our youth are obese, and so they're even more at risk for developing this heart disease, which is, one of the number one killers. It is the number one cause of mortality.
By the way, that's worldwide. It's the number one killer worldwide is heart disease.
Right. So the visceral fat, if you can get that down, because even as little as 4 pounds of visceral fat can cause significant health problems. Right.
And that's why it's really important to catch it early. And that's why I love, you guys have an Evolt scan. I've used an Evolt scan in so many medical clinics. And it's one of the things I love about BIA, because I can't send somebody to a DEXA scan every 30 days. I don't want to expose them to radiation, but it is something that is so easy for us to monitor this kind of progress for people every 30 days and just either catch it early before they get more than 5 pounds of visceral body fat, or really watch that be the indicator of what we are taking off of people to show them you are improving your health. And we don't have to send them for labs. It's something that's non-invasive. They just stand on a machine.
Yeah, I love it. Obviously, DEXA, if we could do DEXA on everybody all the time without the radiation, it'd be great. But, I think the bioimpedance is a great way to trend this. And I find it helpful because sometimes patients come in and they maybe haven't lost a ton of weight over the 4 weeks, but when you look at their visceral fat numbers, they've gone down significantly. So I get super excited when I talk to them. Your visceral fat cut in half almost, and so it gets them to see that too and make them aware. So on the educational piece, the Evolt's really helpful with that as well. And
yeah, I mean, I love that. And then, another thing that we don't really talk about that much is non-alcoholic fatty liver disease.
Yeah.
We're seeing a very large rise in that right now.
Well, yeah, and that goes along with the obesity epidemic and, and the increase in visceral fat that we're seeing. So, and identifying that and correcting that is huge for longevity and, fighting off what Peter Attia calls the four horsemen of the apocalypse, which is
Yeah.
cardiac disease, cancer, diabetes, and neurodegenerative diseases. So
Yeah, and I think for a lot of people, like I think about my dad. My dad's almost 92. He's still alive, but he's always had this belly. And he's always said, "Oh, it's too late for me." I would love to put him on a GLP. He would never ever do it. But he says, "Oh, it's too late for me." And I wish people would stop thinking that, because it doesn't matter how old you are. You can improve your health. And it actually, I mean, it may have taken you 20 years to get your health to where it's at, but it's not going to take us 20 years to reverse this. So you can start at any time.
yeah, I mean, obviously, sooner is better, right? Because these diseases develop over decades; they don't develop over weeks. But I agree. I think it's never too late. I've treated 50-year-olds that have had a beer belly, large beer belly, and after a year on GLPs, they've gone down from a 48 waist down to a 34. Visceral fat's like 10% of what it was. You know, it's crazy.
It's really remarkable how much we've changed. You know, I think COVID kind of helped with this. It got people thinking about alternative medicine, and in a bad way, but also in a good way, where functional medicine was a little quacky when we were younger, and now it's starting to become so mainstream, and people are looking for these type of alternatives, to the point where very large pharmaceutical companies are now embracing peptides that we've embraced for the last 15 years. So I do love seeing this transition of a merge of conventional medicine and non-conventional medicine, because it really helps people like with things like this.
Yeah, and I do think the pandemic was really a pivotal point in healthcare, like you said, where people started looking outside the traditional healthcare system for answers. Maybe one, because they couldn't get in to see their doctors, so they were kind of having to do stuff on their own. But also just, the way things were handled during the pandemic, I think there was some trust lost in the traditional healthcare system as well, which is kind of
Yeah, and I think also people started realizing that they have to pay for their health.
yeah,
And so, like, I have clients that are very humble. They don't make very, very large incomes, but they understand that the cost of poor health when they're in their 70s and 80s, and the burden that that is going to put on their children and their loved ones, is worth them working a second part-time job, having an Etsy store, having an eBay store, and getting money elsewhere so they can afford to advocate for their own health, which they were not even remotely doing prior to the pandemic.
absolutely. And it's really a shift in mindset of the United States population, because we are not used in the United States to having to pay for our health care. And so when you talk about it, I talk about it as an investment. When they start telling me, oh, it's expensive, well, I'm like, this is an investment. So you're either going to pay now or you're going to pay later. So you're going to pay one way or the other. So it's better to pay a little bit now so you don't have to pay as much later, either with your health or with your wallet. Right? And I always tell people, no health, no wealth. I mean, you can't do anything if you don't have your health. So it's one of the biggest investments that you can make in your life.
Well, and I really, like, prior to the pandemic, people were wasting so much money on really cheap and crummy supplements.
Oh, yeah.
And I was like, don't pay for that and go pay for the lab work. Like, there's a lot of insurances that will not pay for testosterone in women, testosterone tests in women.
Right.
And I told every single one of my perimenopausal and menopausal clients, I'm like, you need to pay for this out of pocket. Well, it's really expensive. I don't care.
Right.
Because we're not going to fix any of these other problems, including the visceral fat problem that they were having, if we don't even find out what the smoking gun is. And then the shift came during the pandemic, and then people started investing in these other things. And no, they don't get their labs run every 3 months like some of us do, but they're now getting them run twice a year, and they're getting the right labs run, and they're not listening to their conventional doctors, and they're advocating for themselves. And I've seen massive changes in visceral body fat just from their ability to identify the hormone imbalances, the gut imbalances, and all of these things. They didn't even take a GLP. They just went to lifestyle intervention once they had the factual information.
Yeah, and I think that's a good point. I mean, running the right types of labs to look for what what you need to see on the metabolic inflammation side of things, and then using visceral fat as kind of a surrogate of kind of decreasing. As we decrease visceral fat, we're decreasing the metabolic inflammation or the metabolic syndrome, which is really associated with the long-term health problems. So.
And with BIA, we can monitor that visceral body fat. We see that coming down. I know that there will be multiple other health improvements just from getting that down. So I don't have to run labs on people every 30 days. I can run BIA and then ask them to go twice a year. And conventional doctors are prescribing labs that they know will be covered by insurance.
Right.
Instead of actually prescribing the labs that people need for longevity and better health. And now there are so many alternative, like online ways to get your labs, and they call it right into Quest or LabCorp. So it's not like you're not getting it from the right same labs your doctors are using. They're just not using conventional methods.
Yeah, I mean, even as a test that I order all the time that not a lot of traditional conventional doctors order is just a basic advanced lipid panel, right? Which looks at the inflammatory markers around cholesterol and diving just a little bit deeper into a lipid profile like that. These doctors do not order this test, and it's super important. So that's just one example of where I think the traditional healthcare system is failing patients, even on just a lipid panel.
But the amazing thing is, the information, like podcasts like these, Peter's podcast, even Huberman's podcast, this information is getting out now. Oh, yeah. So people are starting to get really sharp. Like, we get emails through our Evolt website of people saying, where can I find an Evolt near me? I want to monitor my visceral body fat on a regular basis. Like, these are just consumers reaching out to us, which is, that's the best advocate for anybody, is consumers that realize that this is a problem. It's a problem they need to solve, and they need help solving it.
And they need to solve it fast.
And that is the one thing about visceral body fat. It creeps up very fast. So I always tell gym owners this. It's a great hack for a gym owner. You get an Evolt scan and you scan every single new member on that scan. And then you say, we have this great personal training program that can help you with this visceral body fat issue you're having. And the person says, no, I can do it on my own. You scan them again in 30 days. You say the exact same thing. And they say, no, I can do it on my own. 3 months later, when the visceral fat is climbing up on them, that's when they hire you for personal training, even if it's short-term personal training, because they realize at that moment they can't do it on their own, and it creeps up much faster than they ever thought it did.
Yeah, for sure. When people tell me they can do it on their own, I tell them, well, if you could have done it on your own, you would have done it on your own already. This has been going on for a very long time. So why not partner with people that can help you, get from A to B in a much faster way and a healthier way. So you don't have
why? Because they still think Google is an expert.
Right.
They have not realized, even post-pandemic, they have not realized that Google is a silo of their own beliefs. So you put in information into Google, Google spits back at you what you want to hear, but presents it like they're the expert.
Yeah, it's confirmation bias, for sure.
Yeah, yes. So I love how we always talk about causation and correlation. We talk about this with GLPs all the time because we keep using all this correlative data and saying it's causation. And that is my greatest thing about Google. It's almost all correlation, not causation, that you're getting. And so they do need experts like you. They do need access to technology like Evolt. They do need access to those lab tests. And when we can put those three things together, people's health improves so quickly and saves them so much money in a 1 year, 2 year period. Well, they save money just on food and alcohol alone when they get into these kind of programs.
Well, the other thing they say, when they come to see me, I have them bring all their supplements in, and I find that people are way over supplemented. And so I save people hundreds of dollars a month because I just pare down their supplements. And that money then they can use to actually better their health, So.
Well, and it's expensive, P. We know, I actually worked in the supplement industry for many, many years. And using data to create the supplements, but you got to look at the serving size. You got to look at how many milligrams. And when you start digging into that, it just has become very expensive urine at that point.
Oh, yeah.
And so a lot of people aren't using medical grade supplements. Supplements are unregulated in the United States. And so when I do the same thing, I tell people to give me your supplements and I take them off. And I take off almost all their supplements, and that those supplements are causing them to retain a ton of water, which is like, I put them on an Evolt and I'm like, you have 10 pounds of extra water. What is going on? And they show me their supplements. I'm like, that's your smoking gun right there. And I think that's a big thing. Let's talk about that for a second. When we weigh people, or so when we scan people, we've got fat, we've got muscle, and then we have water, and all of which weigh different amounts. Muscle is denser than body fat. So on a scale, it weighs more, but a small amount of visceral body fat is so dangerous in comparison. So we're constantly talking about my weight, my weight, my weight. Your weight actually means absolutely nothing. It's water, inflammation, and visceral fat that we've got to keep looking at.
Yeah, I have that conversation, I don't know how many times a week about weight. I'm like, weight is not the endpoint here. Like, your body composition is changing for the better, and that's what we need to be focusing on. So if you're gaining skeletal muscle and losing visceral fat, you may actually gain weight on the scale, but that's good.
Yeah, but that's the holy grail of like metabolism, right?
And that's why BMI is so worthless. Right, because it's
so worthless. And none of the doctors I work with are prescribing GLPs on BMI anymore. They don't even use it at all. They're using Evolt results to prescribe their GLPs because they started realizing it's one of the first times in history that we don't have to put people on such a big calorie deficit. So they are losing visceral body fat and gaining muscle at the same time. And it's been revolutionary for so many of us that really want to improve metabolic health.
Yeah, I agree. I mean, I think in the past we were over calorically restricting people. And, I remember myself putting people on 1,000-calorie diets, and, looking back, I'm embarrassed about it because it was not probably the right thing to do. But with this technology and getting the macros dialed in with the Evolt, and then looking at, a moderate caloric restriction, I mean, they can still be comfortable in their diet and lose visceral fat if they do it right. And with a knowledgeable provider that can guide them along the way, they don't have to be miserable. So I try to set people up for a sustainable diet plan so they don't have to have these big swings in their diet, but still be able to be healthy and lose weight and lose the visceral fat and maintain their muscle. And so I think, the combination of Evolt with GLPs is essential. Like, I don't know how people do and work with patients on GLPs without some sort of body composition scanning going on. How do you guide your patients? I don't know. I don't know how people.
Oh, I agree. The other thing that's really cool about the Evolt scan is it calculates BMR and
Yes.
TEE.
Yes.
So often in your career and my career, we, especially women, but men will do this too. If I eat more than 1,600 calories, I'm going to gain weight. And their BMR is 1,600, not even their TEE. Their BMR is 1,600.
Right.
And I'm really trying to explain the Evolt scan is this perfect opportunity to educate people on BMR before you really even have to talk about calories, because then you've got like that monkey off their back, which is really cool.
Yeah. Yeah, and it's good to monitor that metabolic rate as they lose weight and see what happens, because you can adjust what they need during those times too. So, yeah, I think it's just an invaluable tool. The visceral fat aspect of it alone it's helped me a lot educating patients about visceral fat. It opens the conversation, and then once.
Yeah, and the fact that it gives you like optimal ranges for that specific demographic. And so a lot of people are like, yeah, I've got some visceral body fat, but I'm a 50-year-old man. No, for your specific demographic, your visceral fat is much higher than we would like to see it. And it gives them that visual that I think is really valuable to people like us.
Yeah, and another thing is on demographics, it's like thin people, they don't have as much propensity to have subcutaneous fat, so they can be thin and still have a lot of visceral fat, which puts them at health risk. And so those types of people may still benefit from a GLP or at least some lifestyle changes to get rid of the visceral fat. And then you see very obese people that have more propensity for subcutaneous fat and they don't have as much visceral fat. So it's really hard to know, without doing body composition scans.
Yeah, and I get really frustrated when I see on the internet, oh, you didn't need a GLP, you weren't fat. And these are clients of mine that I've seen on a body scan, and I know that they were carrying a lot of visceral body fat, but you're right. They just had no subcutaneous. And I'm one of those people. I can be 20 pounds overweight. I have no subcutaneous fat. It is all in my midsection. And I still have a six pack, even when I'm overweight, because it's sitting behind that muscle and it's pushing it out. And so I literally look like a Lego. And I know that it is so dangerous to my health. I've had to monitor it every day of my life because when you're tiny, people all think you're not fat. And you're literally like, here's my scan. It's not good. It's all visceral body fat.
Mm-hmm. Yeah. And I think, getting the awareness of that, just getting that thought process into their universe, it can be transformational for them alone.
Yeah. So if you had any advice for people that are really trying to improve their health, what would be like some knowledge nuggets for them?
Well, I try to keep it super simple. So I use it KISS. So, exercise and diet are non-negotiable. Exercise is probably the most potent longevity drug on the planet. It helps with insulin sensitivity. It helps build lean body mass. We know that people that have more lean body mass live longer, healthier lives. And that has to start when you're young, because after age 50, like myself, we get anabolic resistance and it becomes a lot harder to keep that lean body mass. So you have to condition.
I turned 50 and it was like a light switch flipping. Yeah. It was so crazy.
Yeah. So that for me is paramount. Two, eat organic, eat healthy, shop along the outside of the grocery store. Don't go in the middle aisles. It doesn't have to be complicated. Three, when you're choosing a diet plan for yourself, choose something that you can do your entire life. So choose a sustainable diet plan that can help you achieve your goals, because flip-flopping between all sorts of fad diets and all these things, it's not good for your system and you'll be miserable. So pick something that you can do every day for the rest of your life.
Amazing. That's great advice. Dr. Chiriano, thank you so much for joining us. And we will talk soon. Have a great day.
Great, thank you.
That was the amazing Dr. Jason Chiriano from Viva Life Healing Centers. I am your host, Sharon Polsky, and I want to thank you for tuning into the Healthy Returns podcast. If you enjoyed today's discussion, please give us a like and a subscribe so you don't miss any more of our upcoming episodes. We publish an episode every other week. And for more information about the Evolt 360, you're going to go to www.evolt360.com. Thank you so much for tuning in. I can't wait to see you next time. Ciao for now. The Evolt podcast is for informational and educational purposes only. The content shared here represents the views and opinions of the host and guests and should not be considered medical, health, or professional advice. This podcast is not a substitute for individualized care from a qualified provider. Please consult with your provider before making decisions that may affect your health and wellness. Any statements about treatments, health protocols, or medications discussed are based on personal experience or professional expertise and may not be suitable for everyone. Always seek personalized advice from a licensed professional who understands your specific needs.